Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Navigating a mastectomy can be an overwhelming experience, making it essential for patients to be well informed about the procedure. This discussion is a must for those undergoing a mastectomy, as it aims to provide comprehensive insights into what to expect before, during, and after surgery, from understanding the different types of mastectomies to exploring post-operative care and emotional support. This conversation will equip patients with knowledge and confidence needed to face this journey. To join us, to gain valuable information and find support as we delve into the critical aspects of mastectomy, ensuring that no one has to go through this alone. Welcome everyone. I'm Dr. Soumya Saluja from THIP Media, and today, to help us understand the surgical procedure of mastectomy better, we have with us the distinguished health expert, Dr. Aditya Narayan Chaudhary. Dr. Aditya is a highly proficient and dedicated plastic surgeon who is presently associated with the Heritage Institute of Medical Sciences in Varanasi. He began his professional journey as a senior resident at Banaras Hindu University, where he refined his abilities and gathered priceless expertise. He did his hair transplant training under distinguished Dr. Manoj Khanna in Kolkata and learned facial aesthetic procedures at M.S. Ramaiah, Bangalore. Dr. Aditya continued to improve his skills while working at the prestigious Rajiv Gandhi Cancer Institute and Research Center. Additionally, he has worked as a visiting senior consultant at Pristine Care. Dr. Aditya's impressive expertise includes a broad range of plastic, aesthetic, and reconstructive surgical procedures. Dr. Aditya, THIP Media welcomes you, sir.
Thank you, ma'am. How are you?
I'm fine, sir. And thank you for your time for this very, very important yet very sensitive topic. So thank you so much for joining us today. Sir, we all understand mastectomy at times, can be a life-saving procedure. Yet you must have come across people, who could be scared of undergoing this surgery. So just in the line of bridging this gap, I'm going to start this discussion with the most fundamental, very basic question that what is a mastectomy and when is it recommended?
So my mastectomy basically is a surgical procedure that involves removal of one or both breasts. It can be partial or complete. And
Okay.
it is recommended in various situations like in breast cancer or patients who have high-risk breast cancer genes, those who have family history of breast cancer. In cases of recurrent breast cancer, then there's something known as a Paget's disease. It's a rare type of breast cancer that affects just the nipple part. And then
Okay.
in certain cases, prophylactically, like when the cancer is very remote, like in ductal carcinoma in C2.
Okay. Right. And what are the different types of mastectomy procedures are available? And how, do they differ in terms of, like you just mentioned, that they can be partial or complete removal of the breast? So in terms of the extent of tissue removal.
So, ma'am, first of all, very easily there is total mastectomy, the complete removal of breast tissue. Then there
Right.
is a modified radical mastectomy, in which apart from the breast tissue, lymph nodes from the axilla, that is the area of the underarms, those are removed. Then there is radical mastectomy, in which the lymph nodes, apart from the breast tissue, of the chest area are also removed. Then there is skin sparing mastectomy, in which the skin is left behind. In this case, the lippal areola complex may or may not be removed. Then there is specifically nipple sparing mastectomy for those patients who are concerned with that. Then there is lumpectomy, in which only a part of the tumor and the surrounding normal tissue is removed. Then there is
Okay.
bilateral mastectomy, in which both the breasts are removed. And then there is something known as prophylactic mastectomy, which we do in patients who don't have cancer as of now, but they are at
Okay.
high risk for cancer. So we remove one or both breasts to prevent future cancers in these individuals.
Right. And does a mastectomy impact the physical and emotional well-being of individuals who are undergoing the procedure? And if so, how can such individuals prepare for mastectomy surgery, let's say both physically and emotionally?
So obviously, ma'am, any procedure for that matter affects
Okay,
an individual's physical and emotional well-being. And since breasts are so innately linked to the existence, the life, and the gender identity. So obviously, it
right,
has a great impact on a patient's mental well-being and all. So for physical
right,
preparation, we obviously expect them to consult with the surgeon and follow the pre-surgery instructions. Apart from that, for wound healing, we expect them to stop smoking, avoid alcohol, and to exercise regularly if possible. And we also expect them to get their homes ready for the physical recovery after the
right,
surgery. As far as the
right,
emotional part is concerned, it is very individualized, but obviously, we all need support. So we encourage the patients to seek support from the loved ones or support groups. Then we ask them to educate themselves about the procedure, the recovery. Then we also bring them to terms with the body image concerns that they might have after the surgery.
right.
Then we advise or suggest, or our counselors, they suggest them to practice stress reducing techniques like meditation, deep breathing, and all. Apart
Mm-hmm.
from that, ma'am, sometimes the patients, if they are very well educated and intelligent, we ask them to understand and go through regarding the pain management options, the
Right,
complete plan for post-op care, and we
right,
also uh, ensure a consultation prior to surgery with a physical therapist who can help them take care of the physical health after the surgery. So
okay,
it's mainly individual,
yeah,
the choices, the preferences, and the needs, and we encourage them to take a look into whatever concerns them, and then we help them and guide them in how to sort out those concerns.
right. And what are the factors to consider when deciding between mastectomy and, let's say, breast-conserving surgery for the breast cancer treatment?
So, ma'am, the primary concern as a surgeon for me is obviously that all of the cancer tissue has to be removed.
Right,
But just for preserving the breast, we cannot let the disease persist in the body. So, various
right,
factors that decided are the cancer stage and the size, the tumor location, and whether it is
right,
located at a single place or multiple places, that is the multifocality, the breast
right,
size and density, then the family history, and if they have any genetic risks, then their own personal preferences and values. For example, an elderly female will not be very much interested in retaining her breast if there is a danger of cancer recurrence, whereas a
right,
young female will want to retain her breast tissue. Then
right,
other options regarding hormone receptor status, then if the radiation therapy is needed, or if the patient wants reconstruction, that helps us take this decision. Then apart from that,
right,
also the overall health, the medical history of the patient, and the quality of life and body image concerns. So these
right.
all impact our decision with regards to whether we have to go for the whole breast or just the tumor affected part.
Okay. And like you just mentioned that it is very individualized, like how much tissue is to be excised prior surgery, and that usually depends on the patient.
Yes, ma'am.
So can mastectomy be a part of risk reducing strategy for individuals with a high genetic risk of breast cancer?
Definitely, ma'am. It can be a part of those surgeries, especially those patients who are very scared of the cancer. They are not comfortable with the regular follow-ups, checkups, and they find it a hassle in their daily lives. Or
Right.
those who don't want to live with the fear of contracting the disease somewhat in the advanced stages, they do
Right.
go for prophylactic mastectomies.
Okay. Right. And are there any alternative treatment options to mastectomy for individuals who are diagnosed with breast cancer?
Definitely, ma'am. Again, depending on the tumor, we have breast conservative surgery, in which, similar to lumpectomy, only the
Right.
tumor and the surrounding tissue is removed. In lumpectomy, a little bit extra margin of tissue is removed. Then there are partial mastectomies, in which a part of the breast is removed, remaining the other part. Then we have the options of radiation therapy, chemotherapy. In hormone receptive tumors, we have hormone therapies. Then there are targeted therapies that are part of immunotherapy now. We have
Right.
neoadjuvant therapy that uh, involves a combination of chemotherapy and hormone therapy that is given before the surgery.
Right.
We also use cryoablation in certain cases, in which we freeze and kill the cancer cells using a probe. But
Okay.
we must remember that these alternatives are only suitable for early stage cancers, small tumors, or
Right.
low grade cancers, and
Right.
in case of hormone receptor positive cancers.
Right.
So there are very limited indications for these.
Okay. And now for those who, who have already undergone the procedure or were about to undergo mastectomy, what are the potential risks and complications, associated with mastectomy surgery that the patients should know about?
So there are a lot of them, starting from inflection to bleeding to fluid accumulation, that is the seroma formation. Then there are wound complications like wound dehiscence. Then there is obviously scarring is there. There is numbness or tingling. Then there's
Right.
something called phantom breast pain. Even when the breast has been removed, people experience pain in the breast. Then there is
Okay.
lymphedema or the arm swelling. Then in certain cases where radical mastectomy has been done, we encounter shoulder or arm mobility issues. Have been cases of deep vein thrombosis, nerve damage. Then, when we come back to the reconstruction part, then there are
Right.
complications related to the reconstruction. There can be asymmetry, unevenness, and obviously, since we are also talking about the emotional well-being of the patients, there can be psychological distress or body image concerns with these patients. So,
Okay.
in long term, obviously, there can be limited arm mobility, chronic pain, or this lymphedema management has to be there.
Okay.
So all of this plays a big role, and the patients have to know about this before the surgery.
Right. And now coming on to the ones which need more emotional support from my point of view. How does mastectomy play a role in gender affirmation surgeries for transgender individuals?
So obviously, mastectomy for transgender individuals, particularly trans men or those binary individuals that are assigned
Right.
female sex at birth, is
Right.
referred to them in as top surgery, which involves removing the breasts to create a
Right.
more masculine chest contour that aligns with
Right.
the individual's gender identity. So,
Right.
apart from aligning them, it also reduces gender dysphoria, improves their self esteem and confidence, and enhances the overall mental health and well being.
Right. Okay. And what precautions should patients follow after undergoing mastectomy? And do these instructions, vary depending on the reason behind the procedure?
So, ma'am, basically, we always advise rest and ask them to avoid strenuous activities for about 4 to 6 weeks. We ask them to wear supportive compression garments. Then, obviously, there are wound care instructions. Then, the pain care managements have to be taken. They have to be taken very attentively. We ask
Okay.
them to attend follow-up appointments with the healthcare team. They have to avoid heavy lifting, bending, stretching, and return to the normal life should be gradual. For example,
Okay.
we start with physiotherapies, then go to gradual arm and shoulder exercises. And then on our part, we obviously monitor for signs of complication. So, as far
Okay.
as individual procedures are concerned, then in breast cancer, we tell the patients to regularly follow for radiation or chemotherapy if needed. Then we
Okay.
ask them for annual checkups and for monitoring for cancer. And we also ask them to consider for reconstructive options if they are interested. And
Okay.
in gender affirmation surgeries, ma'am, in certain cases where the breast is large and a top surgery has been done, we ask them to take care of nipple and graft that we have done. Then,
Okay.
apart from that, we ask them to come for wound checks and dressings and consider hormone therapy so
Right.
that their image and the body image aligns with each other. Then,
Right.
apart from that, obviously there are risks regarding to lymphedema and reconstruction and emotional support. But we already have guided these patients in advance, so uh,
So,
we ensure easy transition into the post-operative phase.
okay, great. And you just mentioned about the reconstructive options. So, just coming to that, what are the reconstructive options available to individuals who choose to undergo mastectomy?
Ma'am, we have implant-based reconstructions like we discussed in our last podcast, the silicone
Right.
or saline implants. Then we have tissue expanders. We can
Hmm.
also reconstruct the breast with patient's own tissue, like the abdominal tissue
Right.
or the back tissue in form of various flaps. Then we can
Right.
use both of these together if the requirement is of a large breast and single reconstruction strategy is not adequate. Then,
Right.
as far as nipple areola reconstruction is there, we have various procedures like areola tattooing is done. Then, from the other breast, we can take a part of nipple and use it as a graft. Then, to enlarge the breast, we can do fat grafting taken from the
Okay.
abdomen. Then, apart from that, some patients they use external breast prosthesis or they go for nipple areola area tattooing to match the color with the opposite breast.
Okay.
So these things are there, and obviously the patients should know that the reconstruction can be performed immediately or it can be delayed. That depends on the disease and the patient's requirement, and it's
Okay.
not just fixed set of guidelines. It is a tailor-made solution every time a patient comes.
Okay. So I'm just going to summarize this wonderful session with something very important, that's health literacy. So how does the health literacy play a pivotal role in ensuring that, individuals understand first the significance of this life-saving procedure, and how does this knowledge on mastectomy can empower them to make informed decisions about their breast health and treatment options?
So, health literacy on the patient's part basically ensures that patients comprehend the medical information that is given to them, the heavy load of medical information
Right,
or the barrage that the doctors, the chemotherapists, the oncologists, they bombard on them. And it
right,
also facilitates them in understanding what are the various options and risks of each treatment option, or if they choose
right,
not to undergo them. Then it empowers the individuals to ask questions and seek clarifications from us.
right,
Then so that we as healthcare professionals can support them in informed decision making, and
right,
we can have a better patient and treatment provider communication. It also helps in
right,
reducing anxiety and promotes self advocacy, and it encourages them to participate actively in the self care part, ma'am. That is very
right,
important. Sometimes patients feel that this part should be done by the nursing staff or the doctor staff. No, you yourself also are a part of it, and
right,
since they take the charge of their own recovery, it is
right.
faster and more comfortable.
Right. So the message is very simple that, health literacy helps everyone to take charge of their own systems, and just not relying on the doctor and the patients is not enough. Great. So on that wonderful note, I really appreciate your presence with us today, sir. And I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us. It's really been a pleasure.
Thank you, ma'am. And I would like to congratulate the Healthy Indian project, the Health Tech, and the company on your part for doing such great job and bringing all this education and knowledge to the patients with respect to various diseases, whether this is mine or the gynecological disease or the other diseases. And it's our contribution, small contribution in making lives better one at a time. So hats off to you guys.
Thank you so much for these wonderful words, sir. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Thank you.